posting isn't private. Beware what you share.
Addiction. It's a battle that we all struggle with at some point in our lives. When the challenges and questions of addiction are in our path, the answers and solutions are not easy to find. But in Fairfield County, Ohio, there is hope. There is help, and there is healing. Steve Rao leads us down the road to recovery.
Hello there, and welcome to another edition of Road to Recovery, the show that attempts to offer hope and help and wholeness and healing for those who may be struggling with addiction, or maybe you have a family member or friend, a coworker, a neighbor, someone that you're close to that is having a struggle with addiction. We want you to know there is hope available, and we love to bring folks on the program who can help us understand where that hope lies. My name is Steve Rao, and we encourage you to contact the Recovery Center, and they can give you some more information. They're located at 201 South Columbus Street in downtown Lancaster. They can be reached at 740-687-4500. Our guest today is got a long and storied history, and he is now moving into another aspect of his life, so we would like to pick his brain just a little bit. He is Orman Hall, former director of the Ohio Department of Alcohol and Drug Addiction Services, and most recently, the former director of the opiate cabinet position put together by Governor John Kasich's office here in the state of Ohio. Welcome back to Road to Recovery, Orman.
Great to be here, Steve.
It's great to have you joining us here today. And congratulations on your retirement.
Thank you, sir.
I know you're not riding off into the sunset.
Not completely.
And you're not looking for a good shuffleboard game. You've got some other things planned. But I'd like to talk to you a little bit about your position at the state office in the capital city. What are you seeing as it relates to the movement of addiction, especially opiate addiction?
Well, what a great question. Well, first of all, our state still struggles substantially with some very serious problems around prescription opiate and heroin addiction. What we know is that if you go back historically, if you go back to 1979, here in the state of Ohio, we had fewer than 200 people dying from any form of addiction. Now, if you flash forward to 2012, we had 1,914 people that we were aware of who had passed away because of drug overdose.
That's almost 10 times.
Almost a tenfold increase. And what we believe to be true is that those numbers for 2013 and then 2014, when they are completely available, will show that overdoses are still increasing. So we still have some very serious challenges around opiate and heroin addiction for a number of reasons, which I'm sure we'll get into here in just a few minutes. But I believe that the groundwork has been set. The stage has been set for our state to make very important, significant progress here over the next year or two in terms of seeing those overdose numbers decline rather dramatically.
It's the reason why the governor's office developed this opiate cabinet position, isn't it?
It is, and in my mind, the issue of opiate and heroin addiction, and they're the same thing, it is, in my mind, the most serious challenge confronting our state from the standpoint of the human toll that it's taking.
Do you know if there are other cabinet positions in other states, or is this relatively new way of approaching the problem?
There are a number of states across the country that have a laser-like focus on this issue. Ohio's not alone in terms of the struggle against prescription opiate and heroin addiction. So there are a number of states that are being very aggressive and are very concerned about this problem.
Well, we have to address it from multifaceted positions.
We do.
And in your position at ODATIS and with the opiate cabinet position, you really had to interact with a lot of departments. Describe for us how that happened.
Well, in the very beginning, and you know, I really have to give a lot of credit to our governor. He realized from the outset we couldn't approach this problem as just a treatment problem or just a healthcare issue. And so really the approach was to make sure that we had a strategy that spanned interdiction, to make sure that we had law enforcement on board, that we had a clear vision around how we needed to treat the problem, and then a focus on making sure that our healthcare system understands how dangerous and addictive prescription opiates are. And I think to some extent our healthcare system has lost sight of that. And then the fourth leg is making sure that the citizens of the state of Ohio are also completely aware of how dangerous and addictive prescription opiates and heroin are. And I'm really proud of the work that we've done over the span of the last 4 years on all four of those fronts.
It really takes this collaborative effort in order for the problem to be addressed.
It does.
Really, for lives to be saved and for people to have help and hope and wholeness and healing in their life and in the life of their family. So what is the strategy as far as using these different departments and connecting with the different departments to bring this element of hope to those who are struggling with addiction?
Well, that's a great question too, and let me step back just for a minute. What we know, or what we believe to be true at this point, is that our healthcare system, not just Ohio's healthcare system, but the healthcare system across the country, the unprecedented increase in use of prescription opiates, is largely responsible for the opiate addiction problem that exists in our society. And we still have important work that needs to be done to influence how our healthcare system is using prescription opiates. Steve, what we know is that the United States, with about 4.5% of the world's population, uses 61% of all of the prescription opiates produced in the world. That includes 99% of the world's supply of hydrocodone and about 80% of the world's supply of oxycodone. So and the increase in prescription opiates almost exactly mirrors the increase in overdose deaths. Here in the state of Ohio, the statistical correlation, the correlation coefficient, is almost 1-to-1 between the increased use and the increase in overdose deaths. So the most important piece of the puzzle is making sure that we see significant declines in the use of prescription opiates. There is a place for prescription opiates in healthcare, but we need to see a more aggressive decline in the use of prescription opiates over the span of the next couple of years. And there has been important work around setting the stage to make sure that that happens in terms of establishing guidelines for the use of prescription opiates, both in emergency departments and for chronic pain. The second piece, and this is the one that from my perspective has turned out to be more challenging than what I had hoped, is making sure that there is a unified vision for how we treat opiate addiction in our state. There's tremendous stigma that still exists in Ohio and across the country about addiction, and as a result, the issue becomes murkier than what it should. What we know is that many people who are struggling with opiate and heroin addiction need medication-assisted treatment with medications like Suboxone and Vivitrol. Those medications need to be available in the beginning and sometimes for a number of months in order for people to have an opportunity to engage in treatment and to be in recovery. So we're still working on that particular piece. The third piece of all of this that I think we're struggling with and that was not anticipated was this tremendous surge in heroin that exists in our state now. In today's environment, a standard dose of heroin ranges between $5 and $10 per dose. It comes bundled in a balloon, and it's roughly the equivalent of around 100 milligrams. So you can buy, if you think about this just for a minute, you can buy a bag of heroin, a balloon of heroin for $5. That's 100 milligrams. That's less than 5 cents per milligram. Prescription opiates, on the other hand, are about $1 per milligram. So
Right.
in some instances, heroin is 1/20th the cost of prescription opiates. People get addicted to prescription opiates first,
Right.
and when they can no longer afford prescription opiates, many of them move to heroin, a much more dangerous form of addiction because you can't predict dose strength, and also because it's so rapid acting, it encourages people to use at much higher levels. I'm rambling here a bit.
No, you're doing a great job of helping us see the problem. There is work being done on
all of these fronts, Steve.
There really is. So for somebody who might be struggling with addiction or have a family member or friend that's struggling with addiction, what hope would you provide them? Because there is a lot of work being done to make it better.
There is a lot of hope, and there's a lot of at this point there's still a lot of misalignment, and so I think for those families who are currently struggling with opiate addiction, people do need to realize several things. Number one, you can't afford to engage in any degree of denial. If you have a family member that is compulsively addicted to either prescription opiates or heroin, and by the time they're using heroin, this is for the most part a later stage addiction. You can't be in denial about this form of addiction. You need to know that this is serious, it's life-threatening, and you need to make sure that your family member has access to treatment as quickly as possible. That would be number one. I think number two, you need to make sure that they get the right kind of treatment. And the right kind of treatment, more often than not, means therapy and medication, as I previously mentioned.
Correct.
And then the next piece is, from the standpoint of making sure that your family member is safe and they survive, naloxone needs to be available. We haven't talked about naloxone yet, but it is an important piece of the puzzle. It is what's known as an opiate antagonist, and essentially what it does, if somebody is in an overdose situation, if they are in the process of expiring from an opiate overdose, when naloxone is administered, it puts that person in precipitated withdrawal and it saves their life. Yep. So those would be the things that I would urge family members to do. Take the problem seriously. Do not be in denial. Yep. Make sure that they hold their family member accountable. You need to, if you have a family member struggling with this form of addiction, you need to assume that relapse is a very strong likelihood, and you need to look for the clues that might happen. You need to make sure that they're in an effective treatment program, and you need to make sure that naloxone is on hand. And if you do all of those things, I think people have a really good chance, families have a really good chance of moving their addicted loved one through the stages of recovery.
Outstanding. We're just about out of time. If folks would like to get a hold of you or ODATIS, what's the best way to do that?
Well, if they want to get a hold of, and by the way, it's the Department of Mental Health and Addiction Services, ODATIS, the Department of Alcohol and Drug Addiction Services, and the Department of Mental Health and Addiction Services, or the Department of Mental Health merged to form the Department of Mental Health and Addiction Services.
I see.
So if they want to learn more about our state's service delivery system, they can look that up on the web at www.mh.state.oh.us.
Very good.
So that's the website, and the number that they can call is 614-644-8452.
Outstanding. Thank you for your leadership while you were a part of the State House there in the capital city, leading this charge. Whenever I would read an article out of the state, I saw Orman Hall's fingerprints all over it. You have a real passion, a real desire to see people healthy and whole and helped through this challenging process. Thank you for staying involved in the process even as a retiree, and we encourage you to keep up the good work.
Thank you, sir.
That's Orman Hall, and he's joined us here on the Road to Recovery program. You can contact the Recovery Center. They're at 201 South Columbus Street in downtown Lancaster and can be reached at 740-687-4500. Join us next time as we continue to journey down this road to recovery.
These waters were woven into the culture of Native American tribes. The descendants of the early Europeans built a business here based on agriculture. And today, this unique destination in the central Ohio countryside comes to life with stories and memories centuries old. The Fairfield County Historical Parks invites you to amazing Rock Mill. Above the falls of the Hocking River Gorge, here together, nature and man have created some truly American stories that you'll want to experience with the entire family. Visit us or learn more about Rock Mill and the largest wooden water wheel in the nation at historicalparks.org.